Hello, my name is Professor Elizabeth Eakin, and I'm the head of school at UQ School of Public Health. Today I have the pleasure of introducing you to our school's postgraduate program directors. Each of them will outline our master's programs in public health, epidemiology, environmental health sciences, and biostatistics. I trust the information you find here will be helpful on your path to postgraduate study, and I very much hope to one day welcome you to our School of Public Health. But before we officially begin, I would like to acknowledge the traditional owners of the lands on which we're meeting here today in Brisbane and Southeast Queensland, the Yagra and Turrbal peoples. I pay my respects to their ancestors, past, present, and emerging. I'd also like to acknowledge our school's very strong commitment to equity, diversity, and inclusion. We welcome students and staff from countries all over the world, from various ethnicities, cultures, a variety of language groups. It's part of what makes our school such a great place to be. And it's part of what helps us to achieve our mission, working together to improve the health and well-being of populations in a changing and inequitable world. It takes all of us, a diversity of thought, of opinion, of solutions. This is the way that we work together to tackle global public health problems.
Hi, I'm Dr. Paul Gardiner. I'm the Program Director for the Master of Public Health here at the University of Queensland. I'm going to talk to you a little bit today about the Master of Public Health program, but before I do, I'd like to introduce myself. I have over 20 years of experience in research. I started off in biomedical research, doing research in labs. Then I moved to clinical research, before I finally found the light and moved into public health research. I've looked at things like the health of older women, parenting programs, alcohol and drug evaluation programs, and currently I'm looking at healthy aging. So now let's move on to the program itself. Our mission for the Master of Public Health program is that our program nurtures and educates future public health leaders who can critically reflect, innovate, adapt, build relationships, and create change to improve the health and well-being of populations in a changing and inequitable world. We're really focused on developing leaders in the public health space, and we expect that our graduates will work here in Australia, but also they may return back to the country where they grew up. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organised efforts of society. So when we think about health, we go beyond just an illness or an absence of illness. We think about a more holistic approach. We think about emotional, social, and physical well-being. And public health is more than just treating disease, like in clinical medicine. We're actually interested in the upstream impacts on disease. So we're looking at things like the determinants of health, with the social, economic, cultural, or ecological. And it's really about prevention, protection, and promotion of health. So here we see the world's Charter of Public Health. In the middle, we have protection, prevention, and promotion. And these relate to things like communicable disease protection, prevention through vaccination, or promotion through supporting communities. And there's a number of different functions. So there's governance, it's about good leadership and policy. Advocacy, in terms of trying to advocate for improvements in public health. Capacity is really about building the workforce. And of course, we rely on the evidence and information, whether they're from monitoring or surveillance systems, or things like randomised control trials or systematic reviews. So here we see some different areas of public health in terms of managing health emergencies like COVID-19, vaccination against different diseases, control of infectious diseases. We're also interested in managing environmental hazards, promoting healthy behaviours, and we take a real focus on different settings such as the workplace. The Master of Public Health was redeveloped in 2023, so you've got one of the most up-to-date and current programs in Australia. It is one of the few programs in Australia that is accredited with IUPI and also AFIA. We have streamlined the program and co-designed it with key stakeholders, including your future employers, but also with past students, so alumni. We have a real emphasis on employability skills to make sure that you get those jobs when you graduate. The program itself is embedded with entrepreneurial education, and we have a number of core work-integrated learning or research capstone experience options. So the program at UQ will give you the knowledge and confidence to influence and inform health policy, develop, implement and evaluate public health programs, understand and intervene on complex health issues, so focus on systems thinking, and also to develop an entrepreneurial mindset. The program level learning outcomes are that our graduates will be able to demonstrate an in-depth understanding of the guiding principles and functions of public health according to key frameworks, to apply evidence-based critical, reflective and creative practice to address public health priorities, to demonstrate cultural knowledges and ways of understanding required to enhance the health of First Nations people, to communicate skillfully with diverse audience and stakeholders using a variety of methods and modalities, to understand how to advocate for change related to core public health values, social justice, health equity, diversity and planetary health, and also to work in multidisciplinary teams to protect and promote health and prevent disease in populations with complex local and global systems. We know there's a lot of change in the world and that the world is becoming more inequitable, and we really want our graduates to be able to contribute positively to that. Here is the suggested pathway if you're starting in semester 1, 2024. You can see that we have 4 courses per semester. In the first semester, it's really about understanding some of those foundational concepts. So we have Foundations of Public Health, Introduction to Epidemiology, Introductions to Biostats, and Health Systems. And then in semesters 2 and 3, you apply some of that foundational knowledge in more specialised areas, such as health promotion, qualitative research, and fundamentals of major disease. In your final semester, you'll undertake a capstone. These capstone courses include the Public Health Impact Lab, which is an industry consultancy project. You can do placement within one of our industry partners, or you could do a research project. This slide contains the list of core courses. So there are 12 core courses that you will do. There you can do 1 or 2 capstones, and then there's some electives that you could choose from as well. Some of these are in the nutrition area. Some of these are more epidemiological focused. We also have courses related to public health in pandemics, One Health. So there's enough to interest everyone. One of the key features of our program is a new capstone course. This is called the Public Health Impact Lab. And students will engage as consultants on real-life projects identified by industry or community partners. And the teams of students will work in partnership with stakeholders to apply innovation and co-design solutions to pressing public health issues. For instance, in our current Public Health Impact Lab, students are doing a needs assessment around the needs of women in prisons. In terms of applying for the program, you need to have an approved degree in the same discipline. There is the option to commence a graduate certificate or a graduate diploma in public health and then articulate up. And we have 2 intakes. So you can start in semester 1 of 2024, or you can start in semester 2 of 2024. And the intake dates are on the slide. In terms of what you can do with your public health degree, so your Master of Public Health, you can work as a policy officer, as a research assistant, as a public health advisor. You could go on to do a PhD or become a lecturer. you can see that most of our graduates would work in healthcare services, some work in education and research, and there's many more sectors. Our graduates are mainly from Australia, but we also have a number from Southeast Asia, from North America, South America, Africa, and Europe. So at the end of the day, your postgraduate study in public health can take you anywhere. And importantly, our Master of Public Health program will prepare you for an exciting career, whether it be in health promotion, nutrition, digital health, epidemiology, policy, or research. So thanks for listening, and I look forward to welcoming you on campus to the Master of Public Health in 2024. Thanks.
Hi everyone, my name is Dr. Amalie Dyda and I'm the Director of the Master of Epidemiology here at the School of Public Health at the University of Queensland. And today I'm here to introduce you to our program. So I'm an infectious disease epidemiologist. I have been working in epidemiology and public health for about 12 years now. I didn't always plan to become an epidemiologist. I was studying public health. I knew I wanted to work in population health, but I didn't really quite know how. And in my honours project, I was very interested in women's health and resource-poor settings, marginalised populations, and I was lucky enough as part of my honours project to go and work in the Pacific on an epidemiological project where I went and collected data on HIV behaviours and HIV testing. And when I came back from that study, collecting all the data, it needed to be analysed, and I didn't have that skill set. But because I had met the people that I was collecting the data from, the data didn't seem like numbers to me. It felt like people's time and effort that they had spent to give me that information. So I really wanted to do justice to the time that people had given up to give me that information. And so I spent a lot of time studying epidemiology in my honours to really be able to analyse that data. And I realised that I really liked it. So I went on and did a Masters of Applied Epidemiology. And that's how it all started for me. Since then, I've worked in a number of health departments around Australia before coming over to academia. And now I really work on vaccine preventable diseases and vaccination. And I try and look at how we can incorporate machine learning and artificial intelligence into public health practice. So I'm here today to talk to you about our Master of Epidemiology program, and we have here the definition. So epidemiology is the study of the distribution and determinants of health-related states and events in specified populations. And that means a lot of different things. I'm guessing since the COVID-19 pandemic, a lot more people understand and know what epidemiologists do. But really, I think a lot of people think about stats and numbers, which is a big part of it. But really what it is about providing an evidence base. So to make any kind of public health decision or take any kind of public health action, we need some evidence to start those decisions with. And that's what epidemiology is really about. So if you're really interested in solving puzzles or providing evidence, then epidemiology might be for you. So what we have is a 2-year program, and there is flexibility to tailor the degree to reflect your interests and professional aspirations. So I'll talk about it in a little bit more detail on the next slide. But we do have a project that can be really specific to your interests. And what kind of careers do our graduates have when they finish their degree? So some of them might work in academia like I do. Others might work in government, or public health units as epidemiologists, but also more and more in non-government agencies and research institutes, as well as private industry. So things like medical device companies and pharmaceutical companies. And also people work in these kind of organisations across the world, not just in Australia. So what will you do if you come and study the Master of Epidemiology with us? So there's 3 core parts to our course. The first are all of the core units, and I have those listed on the slides. I'm not going to go through all of them, but one of the things that I will point out is that we have things like the Foundations of Public Health, First Nations Health and Wellbeing, which may not seem particularly epidemiologically based, but as well as the epidemiological type information that you'll learn with us, what came through when we did a recent review of the epidemiological program was stakeholders were saying that you can't be an epidemiologist without working within public health. So you really need some of that public health grounding, which is why we now have core units that cover some of those basics, which will really make people more well-rounded epidemiologists when they go out to practice. We also have electives, which is where some of that design for your own interests can come into it. So these are just some examples. We have foundations of digital and clinical informatics becoming more and more important in public health. Public Health Connect, which is more of a work placement type program, but we have a range of different electives to suit different interests. And then the final part is a dissertation, and I think this is really where your true interests can be explored. So you can choose a project either from your own interest, or we provide a list of different projects being provided by supervisors. And then for a year, part-time, you'll work on a research project that you'll then write up into a dissertation, which really gives you that research type experience, which will be useful for the workplace, but is also useful if you want to perhaps go on and do a PhD. So if you're interested, what do you need? So the prerequisites are a bachelor's degree in a relevant discipline, so something like health sciences, or a bachelor's degree in any discipline with a year's work experience in a relevant field. The other option is we do have a graduate certificate and a graduate diploma. So you can start perhaps with a grad cert if you don't meet the entry requirements and see how that goes, and you can then transfer over into the Master of Epi if that's something that works for you. And we do have a GPA requirement, so you need to have a 5.0 on a 7-point scale in your previous qualification. And if you are interested, our intakes close at the end of November. So that's a quick summary of our Master of Epidemiology program. As I said, my name's Amalie. I'm happy to discuss things at any time. So if you have any questions or any interest, please feel free to email me, set up a time to Zoom, and I'd be happy to talk to you more about it.
Hello, my name is Nick Osborne. I'm Program Director of the Masters in Environmental Health Sciences. My career has seen the encapsulation of both toxicology and epidemiology to try and better understand how the environment around us affects our health. Now, the environment plays an important role in our health when we think about oceans, the chemicals in rivers and lakes, how we produce our food, and from agricultural chemicals such as pesticides or fertilizers. The places where we live, work and play also affect our health. Should there be shade? Is the building built appropriately for our needs? And also sun, air, soil and trees all contribute to how healthy we are. So the environment captures the notion of the factors that are external to us that affect our health. But as we know, the environment is changing. And that means the risk to health by the environment is also changing. And we are better trying to understand that. So around about 1 in 4 diseases are caused by environmental exposures. And if we think about that, well, there's things like climate change and extreme weather events, biodiversity loss. The graphic here, we can see around about 4% of mammals on Earth today are wild. But that means 96% are either us, humans, or our domesticated animals. And that ratio really gives us some information about how diseases may spread if we have the understanding that many of our diseases are transferred from animals to humans. But there's also a whole range of other factors: persistent organic pollutants, natural toxins, pharmaceuticals and healthcare products that are released back into the environment, nanopollution and microplastics. First Nations environmental health is also a very key part of understanding the linkage between environment and health. Our course, the Masters in Environmental Health Sciences, tries to better understand that linkage between environment and health and the risks of living in the modern world and the world that we're yet to build. These complex health challenges are really about complexity. How do we understand the enormously complex environment linked to the enormously complex human health? The topics that we cover and investigate include population growth, globalisation, urbanisation, climate change. We really think these are very key topics for understanding the health of people into the future. As well, we are also interested in those emerging and re-emerging zoonotic diseases, those diseases that come from animals that cause pandemics. We understand, after talking to our partners in government and industry, that understanding that role of environment is key to building a healthy population into the future. The Masters of Environmental Health Sciences is a 2-year course, and we've built it to develop an understanding of the complexity of the linkages between environment and human health. There's a wide range of topics that we explore after completing our core courses. And here are some examples of specialities that people have taken after in the environmental health sciences. So we can see here there's electives around climate, around environment, health, policy and leadership, or toxicology. The types of careers that people pursue after completion of their Masters in Environmental Health include environmental scientist, sustainability advisor, regulatory affairs associate, or principal environmental officer. There's roles both in industry, in government, and in academia. Thank you for listening to my brief synopsis about our Masters of Environmental Health Sciences. If you require any information, please consult the website or feel free to contact me.
Hello, and my name is Dr. Michael Waller. I'm the UQ Programme Coordinator of the Masters in Biostatistics. I've worked as a biostatistician for over 20 years. My area of research is dementia epidemiology, linked data, and biostatistical methods. Today, I'm going to give a little bit of an intro into the Masters of Biostatistics programs at UQ. Now, the Masters of Biostatistics is run a little bit differently. It's run through the Biostatistics Collaboration of Australia, and this is a consortium of Australian universities who work together to deliver the Biostats program. So these are all the universities involved. We have Monash University, Sydney, Queensland, University of Adelaide, and University of Melbourne is an affiliated partner. So how does it work? Well, you register for your chosen university, in this case UQ, and then different universities deliver different courses based on their expertise. The student class that you're with will include students from all of the 5 universities, so it's a great way to mix and interact with students from all over Australia and overseas. The courses are delivered through the Canvas delivery system. And we have a coordinating officer based at the University of Sydney, that's Jackie Vaughan. Okay, so once you graduate as a biostatistician, these are some of the things that you might expect. Now, biostatistician has been identified as an emerging occupation by the Australian government, and you can see here how the number of biostatisticians employed in Australia has almost doubled in the last decade. 87 biostatisticians are employed full-time. Now, the other point to note is that the Masters of Biostatistics and the Graduate of Biostatistics has been accredited by the Australian Statistical Society. Now, your work as a biostatistician might include medical or agricultural research, and your tasks might include collecting, analysing, interpreting, communicating health-related data. That communication part is really important because you want to be able to articulate some complex results in a way that can be understood. In essence, you'll be providing the specialised skills needed to draw conclusions from health-related research. So, as a biostatistician, you have the option to work across many different sectors, including the research and educational institutions or private corporations. Also, government agencies employ a number of biostatisticians, so those government agencies might include Queensland Health or New South Wales Health. Now, your professional role as a biostatistician might be listed as biostatistician, but it could also be listed as principal investigator, lecturer, data analyst, or data scientist. Thank you very much for listening. That was just a short summary of the Masters of Biostatistics. If you have any questions at all, please email me at this email here, and I look forward to hearing from you.
So thank you for taking the time today to explore our School of Public Health's postgraduate programs. If you have any questions whatsoever, please reach out to our program directors or contact UQ via the contact details provided here. I wish you the best of luck with your future studies, and we very much look forward to seeing you here in our School of Public Health.